Good morning, everyone, and thank you for joining us today. Any of our clients on the call will hear us at each accounts meeting or each period where we do management accounts comment on drugs profitability. For some rural dispensing practices, it is what ensures the practice remains sustainable. For non-dispensing practices, it can feel a real struggle to make a profit, but it really is such an important area that can work for you if your team in charge of buying and claims knows the best way to deal with them and all of the quirks of dispensing thresholds and tiers and discounts, to name but a few. Really pleased to have Harriet Hole here today with me, a qualified accountant with corporate finance and innovation experience, as well as general practice and PCN experience, who now supports many practices with ensuring they maximise their PPA or dispensing profits. And that is what she's going to cover for us today. I'm sure she'll also cover in a little more detail the fact that there was around £4.3 million of underclaimed or unclaimed flus, and our practices or business managers will have had an email with a link to the Ash Lane checker to see if they are one of the practices impacted. It is a free checker, so please do check. And then if you are impacted, you can talk to Harriet about the support that they can give you to ensure that you claim this money that is rightfully yours. They've even flagged missed income for one of our practices from around 3 years ago using that. We had flagged to the practice that there was an issue in that year, and the practice had advised that it was increased costs that had caused that, which it was partially, but Ash Lane have the tools available to them that accountants don't in order to check the income in detail as well. So without further ado, as they say, I'm going to pass over to Harriet. Welcome, Harriet, and thank you for joining us today.
Thank you, Kay, for that lovely introduction. It's great to be here. Now, I can't see any of the attendees that are on the call today, but please do make use of the chat to ask any questions as we go through the session. So, as Kay mentioned, I will be talking to you today about your GP drugs profits. We are seeing them decline year on year for a number of reasons. The first is supply discounts are becoming less competitive. The second is dispensing fees haven't really increased in the last decade in real terms. And finally, it's about increasing errors at every stage in the process, from claiming through to reimbursements of your drugs income, that can result in declining profit margins. And at Ash Lane, that's all we deal with, is helping practices maximising their drugs income and resulting profitability from those. We were founded over a decade ago by a practice manager who was dealing with the claims in her own practice and feeling like this is an area which has so much ambiguity and complexity that there must be a better way and a way to actually uncover all of the complexity that sits behind your drugs payments. And so that's what she set out to discover. So she deep dove in this one area, set up Ash Lane with the view to help practices take strategic control of their drugs income. And now we support nearly 500 practices all across the country every single month in ensuring that their drugs income is accurate so that they are reimbursed for all of the work that they're doing in this area. So I'm really pleased to be able to speak to you today about the hints and tips that we have learned through our experience with hundreds of practices that we can share with you to have hopefully a tangible impact on your own day-to-day practice. So I'll be talking you through an overview of the drugs payments. How do you calculate those? How do you know what good looks like? Once we've established that, we'll look at some rules, some tips to maximise your drugs profits in the context of the typical issues that we see cropping up throughout that process. And as Kay mentioned at the end, I will share an important flu update for anybody that hasn't already been sent that form. That's certainly something that is worth listening to. Now, some of you may have attended an Ash Lane talk before, and if that's the case, I would be very happy to make this as useful to you as possible. So as I mentioned at the start, please don't hesitate to ask any questions on that. I know, Kay, we've got an opportunity for Q&A at the end. So firstly, we need to define what we mean by a personally administered item. These are the drugs, medicines, and devices that the practice is purchasing and then administering to patients for which the practice is reimbursed. It includes vaccines, anaesthetics, injections, cancer drugs, also known as GnRH drugs, such as Zoladex, Decapeptyl, and Prostap, coils and implants, some sutures, but not all of them, and only certain steri strips, it's only the 6mm by 75, as well as certain pessaries. Anything that you receive free of charge from Inform, by default, you haven't purchased it, and therefore it doesn't fit into this definition of things that you've purchased, so they are not claimable. So just in terms of defining the topic, we can see that there is an element of complexity there because it's not always clear-cut what you can and can't claim. Now, just for the purpose of clarity, in this talk, I will be focusing on your personally administered items. But if you're a dispensing practice, your drugs income and the calculation I'm just about to introduce will also apply to your dispensed income as well. But given that the personally administered items will affect all practices, I will be focusing on that for today. So to know how your practice is performing in terms of your drugs income, you need to be able to calculate it. Now, the green box here summarizes the formula. This formula can be applied at the practice level, either on an annual or monthly basis, but it can also be applied at the individual drug level as well. And it underpins that PCSE drug statement that you get each month. So, to calculate your drugs payment, we need to take the basic price. That's the amount that you're reimbursed for the drug. It's also called the net ingredient cost, the reimbursement rate, and it's found in the NHS drug tariff. That basic price then has a NHS discount applied. If you're a dispensing practice, that's referred to as clawback. And it's a percentage figure. It's up to 11.18%. That's a discount the NHS are effectively giving themselves. Now, I mentioned it's up to 11.18%. That is determined by the total basic price that you are claiming in a given month. The higher the basic price, the higher the discount that is applied. So dispensing practices more likely to be at the top end of that, around 11.18%. For those smaller practices, prescribing only practices, more likely to be sitting at around 4 or 5% in a usual month of that discount. Then the VAT allowance is added back. That is always 20% of the basic price less the discount. Finally, we add a dispensing fee. Now, the dispensing fee is approximately, at the moment, it's up to about £2.41. And again, it's on a range, and it is determined by the quantity of items that the prescriber is claiming in the month. Now, the number starts to come down, the dispensing fee starts to come down once a prescriber exceeds 480 items that they are claiming in the month. As soon as you go above that number, the dispensing fee starts to come down. So it's really important to try to distribute your prescriptions across your GPs, particularly in months where there's a higher volume of drugs being claimed. For example, flu season, you can use your appendix for that. For some practices, for smaller practices, this is not likely to be an issue in the rest of the year, but it's just something to be aware of. So that's how we calculate our drugs income. Then we need to calculate the profit attached to that. So we deduct the cost that you've purchased the drug for. To make this number more useful, we want to express it as a percentage by looking at the profit margin. So we take the profit and we divide it by the drug's income or the drug's payment and times that by 100 to arrive at the profit margin. The current target profit margin on your drugs is 20 to 25%. Now that has come down substantially. In previous years, we would have talked about it being around 40%. And many practices are operating below that target of 20 to 25%. Some are even making a loss. So once you've established through this calculation how your practice is performing, we can then look at how we can address the possible issues that might be affecting that profit margin. And just to note, it's also worth checking with your accountant, because these are numbers that can be expressed in the year-end account, so always worth chatting to Kay to get more information on that if needed. So to start to identify how we can increase, or as a minimum maintain, that target profit margin, we've established a 6-step approach. Now, the first 3 of these steps are the most fundamental. They're kind of foundational to making sure that you are doing as much as possible. So we'll focus on those to start with. And it's to first make sure that you claim for everything. Second, make sure that you're paid for everything. And third, make sure that you optimize your drugs by managing your suppliers. So I'll take each of those in turn, and then we'll come on to the following 3 after that. So to start with, making sure that everything is claimed. On the left-hand side of my screen is summarizing the process of submitting a claim each month inside your practice. Drugs are ordered by all of your clinicians. Drugs are ordered likely by somebody in your team, and then they are given by all of your clinicians. They are subsequently coded in the clinical system, we hope. And then the FP10s are printed and sent off in the post with the FP34. Now, there's lots of people involved in this process, and therefore it's inevitable that things can get missed. So items might not be counted correctly, or clinicians might not know that they're claimable. They might forget to claim an item, or they might claim the wrong thing. I've also got on there that things can get lost in the post. It is shocking, but it does happen that because these claims are sent in the post, sometimes they don't arrive at their intended address, which can again result in income being missed. Searches are a really important tool to identify where a prescription hasn't been issued, where the clinician has forgotten to do that. But they can go out of date or be misinterpreted as well. So all of these things can result in the practice underclaiming year on year of those drugs. Based on our work at Ash Lane, practices typically underclaim by 10 to 20% of their drugs income each year. So how do we address this? How do we mitigate these issues that can crop up? Firstly, it's important that you have a robust process in place. And that includes all the clinicians knowing where they should be putting their scripts once they have been printed. It includes making sure that the searches that are being used for your month-end process are up to date, and the person that's using them understands the process, understands how they need to be used. It's also important to make sure that your clinicians know to claim all of the items, even the low-cost ones. So sometimes they might not think it's worthwhile, but it always is. And to help remind them of what they should be claiming, it's also worth producing a list of claimable items. And that can be really useful as a visual cue in the treatment rooms to have a poster on the wall which lists out those claimable items. And as part of this seminar, I'm happy at the end that we share a poster of those commonly claimed items with you. You can tailor that to your practice's needs, put that in the treatment rooms as a reminder of what should be claimed. And then lastly, it sounds like an obvious one, but it is important to make sure you send using a reliable postal service, such as Royal Mail Special Delivery. It's an unbelievably frustrating source of error in this issue, and one that can be avoided by just making sure that they are posted off really carefully. So once we have looked at the claiming side of things and what's going on inside the practice, we then need to make sure that everything is paid. So after the claim leaves the practice, it's processed by prescription services, provided that it safely arrives. And then 2 months later, it is paid by PCSE. Just a quick note on timings, that claim can be sent off in the post up to and including the 5th of the month. So the 5th is the deadline, and particularly if you're a prescribing only practice, you can put it in on that date. Dispensing practices, it's safe to put it in a few days before if you can, but where there's a bank holiday, the deadline is the 6th. Once it's been paid by PCSE, so you'll get your drug statement. Now, this convoluted process of, there's some very large machines at prescription services which will scan the documents to prepare that schedule of payment, which is then paid by PCSE. There are issues that can crop up at both the prescription services stage and the PCSE stage. Examples of this are items being missed, GPs not being paid, the wrong drug being paid, or issues around dispensing fees. And these are all things that can result in what we could refer to as revenue leakage. So it's small amounts of income, it may not be huge amounts month on month, but they can accumulate and have a large impact on the practice over time. Or they can happen on a one-off basis at a sizable amount. And again, if they go unnoticed, that can really have an impact on your practice's drugs income. So how do we resolve this? How do we address these issues? Well, this is where we recommend implementing a process of revenue assurance. What that means is forecasting the value of valuing your claim before you send it off in the post. And then when you get your claim from PCSE, verifying that the two numbers, so the amount that you are actually paid versus what you expected to be paid, reconcile. Now, that in itself is quite a substantial piece of work. It's a service that we offer through Compass, which is our revenue assurance platform, can be accessed through an online portal. And that's what we do for our 500 practices. However, there are other steps you can take as an interim to implementing this revenue assurance process. So as a minimum, checking that you have a PCSE statement every single month. In the event that you submit slightly late, so past that 5th of the month deadline, that following month should show a slightly higher payment as a catch-up amount. And then also making sure that you can see those spikes for your flu income once or twice a year to see when those flus have been claimed. There should be that associated increased payment. Another interim revenue assurance check would be to, just as a minimum, record the number of items that you're claiming in the month, and then checking that that tallies back to the number of items shown on the drug statement. It will just make sure that the quantity is correct, even if it's not looking at the type or the dispensing fees. It takes you part of the way there. So that's making sure that everything is paid. Then we come on to rule number 3, which is to manage your drugs, optimize your drug and manage your suppliers. Now, unfortunately, it's not always clear what the resulting income to the practice is for each of your drugs, and therefore it's not easy to compare them to the costs associated with that. And that can be for a number of reasons. So firstly, we've talked through that formula, that being applied to each drug is quite complex. It can result in ambiguity of what your actual drug's income is for each drug. But also, it might not be the same person or even the same team that is doing the ordering, the claiming, and the reviewing of the drug statement. Where they're in separate teams, it can be difficult to maintain that oversight. Not only that, although it is generally possible to purchase your drugs for the same or less than that basic price in the drug tariff, there's no guarantee of it. So it is easy to inadvertently overpay for your drugs. A really good example, well, it's not a good example, it's a frustrating example of this, is Depo-Provera. Depo-Provera is the contraceptive injection, which has a basic price of £6 and a penny. And you can purchase it for that much. It is available from Alliance Healthcare for £6 and a penny. However, I often come across practices that are purchasing their depots for £12 or even £18 per injection. So that's a really clear example of where, just a lack of insight into that cost versus that income results in a substantial loss on the drug. And that's because there are some of these suppliers that will apply that, they're very useful, they're very easy to use, they offer really good availability around delivery times, but they will charge you a premium for that convenience. So to address these issues, it's important to have an awareness of your cost versus the basic price. And you can use the drug tariff, or more conveniently, the Dictionary of Medicines and Devices. So if you Google DM plus D browser, that will bring up a browser where you can search the name of a drug and it will inform you of the indicative price. That's the amount that you get reimbursed for them. And it's always worth tallying your basic price against your supply cost. Generally speaking, there are certain suppliers that offer drugs at more competitive prices as well. Now, they include Phoenix or PSUK and Alliance Healthcare. I also usually mention AAH at this point. However, I do need to caveat them. And the reason for that is as of the 1st of this month, so the 1st of June, they changed their low value surcharge rules. Without wanting to take too much of a tangent, I do think it's an important update, so I'll briefly mention what those rules are. Where you spend less than £1,500 in a month, you may be subjected to a low value surcharge of £75. To make it slightly more complex, that only applies to drugs which are not solus items. A solus item broadly means you can only really buy it from that supplier. And AAH have some solus items which many practices will likely be buying from them. They include Mirena, inclisiran, and decapeptyl. So if you are purchasing those types of drugs, then provided you're not purchasing any non-solus items, you won't be subjected to that low value surcharge. AAH have a list on their FAQ website of solus items, so it's worth having a look on there if you use them as a supplier now, just to make sure that you aren't getting involved in that surcharge, particularly if you're a prescribing only practice. Dispensing practices, you may have already been subjected to that low value surcharge. This may not be an issue for you because your minimum spend in a month might be higher. So that's quite a complex sidestep, but I think another thing that it reinforces is that the purchasing is not always straightforward. It does require quite a bit of time at your desk, shopping around, comparing prices, comparing costs. And that's why we generally say it's best practice to have the purchasing done in the admin team. Now, I was working in a practice at the time that they were changing their process from the ordering being done by the nurses to the admin team. And I know that that's not necessarily the most straightforward process, particularly, if you're a multi-site practice and so on. However, getting through that transition does make the overall purchasing much easier because it means you can get your arms around the whole process from the purchasing through to the claiming, through to the reimbursement. So just something worth thinking about if it's not already being done. So before I come on to the fourth rule, which is do more of what's profitable, I just want to take a moment to talk through a general rule of thumb. So a bit of a bonus, if you like. Now, when I introduced that drugs payment calculation at the start, you might have picked up on the fact that there's a bit of a variable dynamic to the formula. We've got a variable deduction, which is that percentage discount that depends on the basic price of the drug, and a fixed addition, which is that dispensing fee, which won't change depending on the price of the drug. What that means is the formula typically favors lower cost drugs because that deduction, that NHS discount, is more likely to be offset by the dispensing fee. Once you get past a certain threshold, the discount, the amount that you're deducted goes up, just because that percentage result applied to the basic price gets higher over that threshold, and the dispensing fee can't fully offset it. And that means that higher cost drugs are more likely to be loss-making. The threshold is approximately £30. So I'm going to illustrate that with some examples. First, let's look at a low-cost drug, for example, lidocaine. A 10-pack of lidocaine has a basic price and a cost of £4.06. That results in a profit per pack of £24.19, which, when we look at the profit margin, is a substantial margin of 83%. Now, if you think back to the start when I mentioned that target profit margin of 20 to 25%, these lidocaines are doing a lot of work in terms of pulling up that profit margin. And I also mentioned at the start around making sure that even low-cost items are claimed. Hopefully, this helps illustrate it is always worth claiming, even if it's for a low-value item like a lidocaine or a steri-strip or a suture, because of that dispensing fee. That's really increasing the amount that you get per item. Now, let's look at a high-cost drug. So we're applying this rule of thumb. Let's look at Nebido. Nebido has a basic price of £87.11. And again, you can buy it for that much. Now, because of the dynamic I mentioned in the formula, you don't need to worry too much about, but just, know that threshold of £30. It's a high-cost drug, and therefore it is making a loss because the discount that is being deducted is higher than that dispensing fee that gets added back. So what that tells us is it's really important to take care with those high-cost drugs. However, with all good rules of thumb, there is always some exceptions. So I will introduce some of those. Let's firstly look at a contraceptive, a Mirena, for example. Again, they have a basic price and a cost of £88. Applying the logic I just gave you in the Nebido example, we would expect the Mirenas to be making a loss. But we're actually making a £9 profit from a margin of about 9%. The reason for that is that you only pay 5% VAT on contraceptive items, but you still get the full 20% VAT reimbursed to you when you submit your claim. And so the exception to the rule is contraceptives, provided that you are purchasing them for the same or less than their basic price, you can make a profit on those. Similarly, Nexplanon is another example of a contraceptive that you will, it has a basic price of about £83.49. So the example applies there as well. Then I want to look at another example, which is an exception to the rule, and that's Prostap. Prostap is a GnRH drug, and it has other alternatives in the market that can be used instead, namely Zoladex and Decapeptyl. These are expensive drugs. I'm showing the 11.25 milligram Prostap, which has a basic price of £225.72. But because of the other alternatives on the market, certain suppliers can be very competitive in the discounts that they offer. And we can see that here. You can purchase Prostap for about £124, which results in a substantial profit to the practice of £110 and profit margin of 43%. So I know I've given a very clear rule of thumb, which is be careful with your high-cost drugs, but there are some instances where high-cost drugs can still be profitable, and that's contraceptives and where there are significant supplier discounts. I'm also going to take another slight sidestep here, just so that you're getting all the information I can possibly give you at this time, which is inclisiran, also known as Leqvio. It's a lipid-lowering drug. We typically see it given in secondary care, but it's now being rolled out on behalf of hospitals within GP surgeries. It has a basic price of £60, but you can purchase it for £45. So it's an example of where the cost that you can purchase it for is significantly less than the basic price. The result of that is a profit of between about £14 to £18. Now, that basic price of £60 has actually increased over time. So previously it was £50. And in some areas, we've seen ICBs start to either reduce or take away the enhanced service payment for the administration of inclisiran, and that's been justified by this increased basic price of £60. So what that means is if you are a practice that is administering inclisiran to any patients, make sure that you're purchasing it. As I mentioned, AAH are still the supplier that you can get that for £45 from, and you wouldn't be subjected to a low value surcharge. So because there is a chance that your enhanced service payment gets taken away, it's important that you are getting paid for that service through the profit on the drug. So that's enough of my rule of thumb and all the exceptions that come with it. So then we come on to doing more of what's profitable, rule number 4. So supply prices can change. And as we've seen on the previous slide, it's not always clear what's profitable. I've had many practices that are not purchasing in their Prostap or Zoladex or Decapeptyl, for example, because it's so expensive and because that's a cost to the practice that they just don't want to take on. But the reality is, what we've seen on that previous slide, is if your practice is confident that you are claiming for everything and getting paid for everything, and you can purchase it from the right suppliers at the right price, you can make a substantial profit. So on the Prostap 11.25 milligram example, a patient will come in for that dosage 4 times a year. And therefore, by buying it in, that's an additional more than £400 profit per patient per year if you start buying in your Prostap. So it's not always clear what's profitable, but it is worth having that awareness about it. However, I do want to caveat that with all of this information I'm giving you, with all of these decisions, they are not just commercial decisions. They're also, you have clinical priorities, your patients are your priorities, and therefore it's important that you take everything in the round when you're making these decisions. All I'm trying to do is give you as much information as possible to make sure that you're making informed decisions. So what do I mean by that? Well, in some instances, you may do the maths, you may look at your numbers and go, we are making a loss on this drug. But actually, my options that I have to me are, I can send a prescription to the pharmacy for the patient to collect, or I can continue to make a slight loss on that drug. And you may decide, yeah, I'm willing to do that because of the patient experience, because of their needs. I'd rather take that hit. And that's well within your right as a practice. What's important, though, is that you know that you are making that decision and the impact that will have on your practice's finances. So to do that, it's important that you pay attention to those high-cost drugs. Once you have established that you are purchasing from those sort of best suppliers when it comes to the pricing, so that was Alliance, Phoenix, and with caveat AAH, then it's time to start to prioritize those higher cost drugs and just taking those in turn and going, right, how are we looking on these? Where are we making a loss? Do we want to do anything to mitigate that? My next rule of thumb is to minimize stock wastage. Stock wastage, it can happen for a number of reasons. It can be unavoidable. So, for example, emergency drugs not being used and therefore expiring. Sometimes it's unfortunate, so things like fridge failures, particularly impacting your flus. And sometimes it's simply preventable issues that result in stock buildup. So this can be the result of repeat orders being done just based on the last number ordered, as against having a good stock control process in place. But also there's the risk when ordering single patient drugs that if you're buying a high cost special item that only one patient on the practice is on. If they leave the list because they unfortunately pass away or move away, then you are left with the cost of having that very expensive drug on your shelf that nobody else can use. So to address this, it's important that you are reordering based on your stock count. So what do you actually have on the shelves? And what are you expecting to use? What is that activity looking like, as against just based on how many we ordered last month? It's also worth having that in a regular cycle, so it becomes a periodic process. Where possible, it is worth avoiding buying those expensive single patient drugs, sending that script to the pharmacy in those instances just to mitigate that risk. And I mean, there's only so much we can do, but making sure that you've got good fridge maintenance in place to minimize the risk of fridge failure is also really important. So my last rule is to ensure accurate bookkeeping. There is, in some instances, we will be approached by a practice who are worried about what they are seeing in terms of their trends in their finances. And we may go through, apply those rules that I've just given you, and find that we're chasing ghosts, find that there actually aren't any issues. And the reality is that the practice accounts aren't presenting an accurate picture of what's going on in the practice. That can be caused by your accounts being grouped incorrectly. So that means lumping together your reimbursable and your non-reimbursable drugs. One is a source of profit to the practice, the other is a cost. And that sometimes is the result of the bookkeeper not knowing which drug belongs in which category. But it's also worth mentioning that there can be factors outside the practice's control. You know, looking at your dispensing fees, the fact that they aren't going up, that's something you can't control. Your flus, the cost of your flus and the amount that you're reimbursed for them, again, that's outside of your control. And we can see on a slide I'll show you later why that will potentially make your practice finances look in, you know, the trend go downward. But there's nothing you can do about that. It's not an indication of any issues within the practice. It's just the nature of the flus in the recent kind of flu season. So to address this, it's really important that you separate your reimbursable and your non-reimbursable drugs. One of the most straightforward ways to do this is to give your bookkeeper that list that I mentioned at the start for your treatment rooms. Give them that same list and say, you know, the drugs that are shown on this list are reimbursable. Please categorize them as such in the account software so that we can then analyze them separately, make sure that we are getting a clear picture and enabling us to calculate more easily that drug's profit margin. It's also important to make sure that your stock figures are correctly recorded and make sure that you have your cost and your revenues matched to one another. So again, mentioning the flus, sometimes if a claim for the flus is submitted late in the following financial year, you end up with a really lumpy profile of 1 year where the flu income's missed, the following year where there's double the flu income and then it drops back down again, and that can cause unnecessary alarm bells. So just making sure that those timings are matched as well. And most importantly, if you're unsure on these things, it's important to speak to your accountants. You know, you're in good hands with Kay. So making sure that they are steering you as well in terms of any ambiguity around the presentation of these numbers in your accounts. So those are my 6 rules. As I mentioned, I'd like to take a moment to talk about the flus, and I'll briefly talk through the changes that we've seen in terms of the flu profitability to start with. If I take the example of a Seqirus over 65s flu, we'll just look at that for now. So in 24-25, the eligible flu vaccine for the over 65s from Seqirus was the adjuvanted quadrivalent, AQIV. It had a basic price or a refund rate of £13.50, and you could purchase it for approximately £11.20. The resulting profit was £3.91 and the profit margin was 23%. The following year, so last flu season 25-26, the eligible flu vaccine changed to the adjuvanted trivalent, ATIV. It had a basic price of £17.55, which is great. The drugs income therefore goes up, but the associated cost also went up to £15.25. The result of that is the profit dropped slightly per flu to £3.53, and the profit margin dropped even more to 16%. So when I talk about factors outside of the practice's control, this is a really clear example of that. There's nothing you can do to sort of change these figures. It's worth being aware, though, that will impact your practice's profit margin. But there's another important piece of information here, which is this refund rate has gone up substantially from £13.50 to £17.55. Now, the result of that is that when they change the blues, it's very important that you claim accurately. So you claim what is written on the box. And that for 25-26 was adjuvanted trivalent surface antigen inactivated, ATIV. Many practices didn't do that. Instead, they purchased the flu that was written on last year's flu claim, which was adjuvanted quadrivalent surface antigen inactivated. The result of that is that instead of getting that £17.55 reimbursement, they would have got the £13.50 reimbursement. So substantially lower. And before I continue, it's very important to prevent this happening in the future by writing exactly what's written on your on the box that the flu vaccines come in when you go to submit your claim at the end of the at the end of the month. So I'm talking around this issue slightly. So what does this actually mean in practice? We anticipated that practices would incorrectly claim the quadrivalent instead of the trivalent. We've spread the messaging, write what's written on the box, but we're now in a situation where, as the flu data has come out, Ash Lane have been monitoring this, and we've identified that more than 900 practices have been affected by the issue of being reimbursed for quadrivalents instead of trivalents. And the total impact is, as Kay mentioned at the start, £4.3 million. Now, that's actually even higher than what we originally stated. It's now more like £5 million. The average impact is around £4,800 per practice. And it's predominantly these Seqirus flus that are impacted. So Sanofi, if you're purchasing from them, you're less likely to be affected, but it's still worth being aware of this. So that's pretty significant, pretty dire situation for GP surgeries, really, that number have been affected, that number have been underpaid. But the good news is it is possible to correct it. And the better news is Ash Lane know we can tell you if you've been affected. We have chosen to do this as a free check. So if you scan the QR code, you can submit your practice's details, tell us your practice code, and we will then email you a report which will tell you whether or not you have been reimbursed for the correct type of flu. So we're not looking at the quantity, but we are looking at the type. It's absolutely no obligation. You can scan the QR code, receive the report. If we do flag that there's an issue, we can then guide you through the steps, again, free of charge, on how to correct it. So I'll pause there in case anybody would like to scan the QR code. But just to re-emphasize, when we talk about revenue assurance, when we talk about the importance of checking your claims accuracy, this is a really big example of one of those many issues that we at Ash Lane are checking for each of our clients through Compass each month. It's about making sure that you are being reimbursed for the eligible drugs, for the drugs that you've purchased, and that you are being paid for everything you owed. So those are the 6 rules, plus some additional information on the flu vaccines. I will pause for a moment in case there are any questions within the chat.
Super, thanks, Harriet. I'll let you leave those on screen if you like. Oh no, Emma has turned my video on, has moved us on. So no, that's great. Thank you ever so much, Harriet. Again, I know a lot of our practices now use the Compass services, and they are really happy with the results and the fact that it just takes some of that burden out of the practice and that reassurance, and that they either are claiming correctly or what to do. So also you've covered the accurate bookkeeping, which is great. Thank you very much. We don't have any questions at the moment, so we'll just give them another moment if anybody does have any questions.
Absolutely.
Such an important topic, really is such an important topic, and can make such a big difference to the figures. And obviously it's one of what we class as an easy win, not easy as in looking at all the different steps in the process and making sure they're done correctly, but it's getting the money that you're due for what you're doing and what you're dispensing, isn't it? So
absolutely,
it is really important.
With all these rules, it's very much easier said than done, you know, particularly when there's so many other competing priorities in the practice. It's just very easy for this to take a back seat, which is a large part of why, you know, we offer the support that we do. But yeah, it's certainly a complex issue.
Super. All right, we have got one question come in, and that is just requesting that we send the drugs poster over. So we'll send that out to all delegates after. Thank you.
Brilliant.
That's the only question that we've got. So thank you ever so much, Harriet. That's been really, really informative and hopefully helped the practices that have joined us today in making those checks or contacting you. And please do, everybody, make sure you scan that QR code and speak to Ashlane and make sure that you have got your right drugs money.
It's a pleasure. Thanks very much for having me.
Lovely. And everybody listening, keep your eyes open. There are more webinars coming throughout the year on topical issues that general practice is seeing. Enjoy the rest of your day.
Thanks very much.
Thank you.